Joining us now live from Albany, New York, is New York's Governor Andrew Cuomo. Governor Cuomo, I thank you for taking time. I know this is an incredible busy time for you.
My pleasure. Good to be with you, Rachel.
So you announced that as far as New York State can tell from the current models, the number of cases in the state may not peak for another 45 days. Could you explain to our audience what that means and how you arrived at that and how sobering that is in terms of New York's capacity to deal with this?
Well, this is all sobering, right? If you go back and you study the China model, the China trajectory, South Korea, Italy, et cetera, some of the other countries, the big question is, what is the apex? What is the rise of the number of cases? And can the healthcare system handle it? That's what this is really about, right? We know the mortality rate with this virus. We know who it affects. The problem is it communicates so quickly. Can your healthcare system handle it? That's the problem that Italy has. So we're trying to project when the numbers get highest. And the models that we've run suggest that in about 45 days, you'll be at the high point. As you said, 55,000 to 100,000 cases, which does overwhelm our healthcare system. Even worse, Rachel, most people will need ICU beds. Most people will need ventilators. That's why you hear so much about the ventilators. It's a respiratory illness. We only have about 3,000. We would need about 30,000. And by the way, you can't get ventilators. So that's what it's all about, overwhelming the healthcare system.
In terms of the way that New York, or the options that New York has to try to avoid that eventuality or to try to minimize that as much as possible, obviously every day brings an evolution in the policy response here. Today, it seemed like you and the mayor of New York City might have been at odds over whether or not the city specifically should consider a shelter-in-place, stay-in-your-home order like's been instituted in the San Francisco Bay Area. Mayor de Blasio said today that's under consideration, but your office put out a statement saying it's not under consideration. What's going on there?
Well, they are talking about it in New York City as a possible option, shelter in place. We have a lot of local communities across the state talking about different options, right? And everybody has an opinion in this case. From my point of view, I need a statewide plan that works and a plan that doesn't shift people from one place to another place. You know, the population in New York is very mobile. If New York City puts a policy in place that people don't like, they'll just move to Nassau, they'll go to Westchester, they'll stay with their brother, they'll stay with their sister. And I've gone through this a number of times with other emergencies. So whatever we do, we have to do statewide. But we've even taken it a step further in New York. I'm doing policies jointly with New Jersey and Connecticut, and now we're bringing in Pennsylvania. Because none of these policies work unless you have a big enough geographic area. We just closed bars, for example. If you close the bars in New York, people will drive to New Jersey or they'll drive to Connecticut. That actually makes the situation worse. So you need policies that are a big enough geographic area that they'll work rather than people just move to the next suburb where they can stay with a friend or a family member. And that's very important. You say to New Yorkers, I'm a born and bred New York City, Queens boy. We're very good at getting around rules, Rachel. So if you say to me, well, if you're in Queens, you have to shelter in place, you can't leave, I'll go stay with my sister in Westchester. That's how I'll handle it. So we need statewide policies that work.
Well, are you considering a statewide shelter-in-place order or indeed a tri-state order? I ask because this, what's happening in California right now doesn't seem to be a parochial decision. It's about 7 million people who are within that range of that 6-county shelter-in-place order. I've spoken with epidemiologists, including some of the most prominent epidemiologists in the world, who say that is the direction that we're going. Is it something, if it were statewide, if it was in conjunction with the tri-state governors, that you would consider as a larger scale order?
Yeah, well, you have to have it. I think you have to have more than a comprehensive approach. You tell people, for example, you close schools. OK, we close schools. Sounds good. OK, now what happened to childcare? And how does my policeman come to work or my firefighter come to work or my nurse come to work, which is essential because it's about the healthcare system. So if you really want to close schools, then you had to put a child care system in place for essential workers, which we did. You want to shelter in place, what you're really saying is we're closing the businesses, right? Because if you can't come out of your house, then every business shuts down in the city. If that's what you want to do it that way. Shut down businesses. That will reduce the density. So what is the goal and what is the best way to get there? And how do you do it on a geographic basis? To shut down all businesses in the state of New York is a very big deal, especially when other states aren't shutting down, right? Because now you'll have a question for a business, well, maybe I just go to Miami, maybe I go to North Carolina, maybe I go to Chicago. So all these policies have to be thought through. I get it. The optimum would be, just from a disease control point of view, everybody in this country stay home, nobody go outside, we'll figure out how to get you a meal. No doubt that's the best strategy to stop the spread of the disease.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.